This is interview number 5 with Direk.
Our microbiology department do research in the wide areas of the microbiological diseases, including melioidosis, leptospirosis, scrub typhus. We do research from the bench to bed up to the patients and population and policy makers. My personal area is the melioidosis research. And the melioidosis is a bacterial infectious disease. The bacteria is in the soil and water, and people who are farmers in Southeast Asia, they're exposed to the soil all the time, and they can get bacteria into their bodies and present with severe sepsis or pneumonia, and they die. Because the disease is very difficult to diagnose, patients normally come with severe sepsis or pneumonia, which can be caused by many infectious diseases, and you need a good microbiology facilities to do the bacterial culture to grow the bacteria. You cannot diagnose by clinical presentations, so doctor cannot tell you upfront that you got melioidosis. And you have to wait 2 to 7 days before the bacteria grow from your blood or from your sputum or from urine. And most of the patients who die, they die quickly within 1 or 2 days. And when they die, the patients was taken back home to the temple already. But then when the culture results come back, doctors know, but the patient doesn't know. So that made the people awareness about the disease is very, very low. But also we see that in many developing countries, you don't have microbiology facilities tied to the hospital. If you go to Africa, when you have fever, you might put 1 drop of your blood to say malaria or not. And then when you are not malaria, then you just get some antibiotics. So my work mainly try to improve both diagnosis and then improve treatment. And then when you know that the disease is a burden in your areas, we improve the public awareness. We try to connect with the policy makers, and then we are implementing education programs so that people can prevent themselves more, wearing boots, drink boiled water, so that we can see that whether we can reduce the incidence of melioidosis and save more lives.
Do you or your group, are you working on a rapid diagnostic test?
Now we have a kit called Deki Readers that is like a Samsung Galaxy mobile phone attached to the diagnostic kit. Once it's positive, it will ping, let's say SMS to the cloud, and then you can check from the cloud that how many cases you have from that. It's not only just having the test available, but it's also that there are people who know that the disease is endemic in their countries and recommend to use the test. Even we saw the patients in our hospital, 400 cases per year in just one hospital, 200 die. But the report of the national database is just 6 cases die of melioidosis per year. And that is because of the bad reporting system. Doctors know that the patients die, but they don't write the report. So we recommend that those 45 countries should not only just enhance their diagnostic capacity, but also enhance their reporting system as well.
What important lines of research have emerged in the last few years?
We can see for sure that we will have a new emerging infectious disease every year or 2 years. You can count Ebola, Zika virus, maybe new SARS very soon, new flu very soon. So we should have our research ready to attack those kind of the new emerging infectious diseases, and also the collaborating between the multiple researchers or organizations worldwide.
Why does your line of work matter, and why should we fund it?
I think because microbiology is a part of the infectious diseases. Many infectious diseases are from bacteria, virus, or parasite. That is not only just malaria. Also, we know that it kills a lot of people worldwide and is preventable. This infectious disease hit the lower income countries, middle income countries, and a lot of poor people worldwide are dying of this disease, which should be able to prevent. And I think that's why we still should improve the research and guide the policymakers to save lives.
How does your work fit into translational medicine within the department?
In the translational medicines, we means that we use the up-to-date advanced knowledge into the implementation so that it can save real lives. So we try to bridge all of the bench works basic science about cell, about organelles of the cells, and then we try to make sure that those knowledge are not just in the publications, but we take it down, we try to see whether we can improve diagnosis, we can improve treatment, and at the same time, when we see a lot of patients, we try to improve the surveillance and give the information right to the policymakers, so that at the end it have a better life and improve outcome of their lives.
What are the benefits of working at MORU for you as a microbiologist?
Would you like the beautiful answers or the real answers?
The real.
The real answer. During the last 15 years that I work with the MORU, it's like a springboard to the up-to-date advanced science into the global communities, and I have the access to the policymakers worldwide. I work with the well-known professors from the Oxford universities and from the other universities from both US, UK. So that's why I really think that working in the international organizations like MORU is the best experience of my life.